of a weight loss surgery. So pre-op holding, surgery, PACU, and into your room and what to expect. So if you're interested, stay tuned. Hey y'all, it's Erica with Time to Shrink. I don't know if all of you know this, but I'm a nurse and I also am a weight loss surgery patient. I had vertical sleeve gastrectomy in November 23rd, 2019. So I just thought it might be helpful to a lot of people if I touched on the subject in detail of what to expect that first 24 hours. This video is specifically going to be talking about American hospitals, and it's going to be pretty detailed, but it's also going to be a little bit all-encompassing because obviously every surgeon is different, every hospital is different, and if you go out of the country for surgery, a lot of this is going to apply, but not all of it. Sometimes it's a little bit different in different countries. So for the purposes of this video, we're pretty much going to talk about America. I personally had surgery in Mexico, but I also personally have taken care of many weight loss surgery patients in my years as a nurse. You're going to show up, let's just give you a time. 8 a.m. is your surgery, okay? So you're going to show up, depending on the hospital, you're going to show up at 5:30 or 6 a.m. and you're going to go to pre-op. They will have already told you where to go. You're going to go to pre-op registration. Now this is going to go really quickly because almost always you've gone a week to 2 weeks before for a pre-op appointment where they take blood and vital signs and EKGs and do lots of paperwork, lots of questions. But if there was not a nurse who went through 5 million questions with you at that pre-op appointment, then expect to have a lot of that on the day of surgery because they have lots of paperwork to fill out on your history. But again, usually that's been taken care of. So then you're going to be walked into what we call pre-op holding. This is just a big room with lots and lots of cots circling a big desk usually, and around each cot there's like a curtain that can be pulled. So they're going to put you in your little cubby with the curtain and they're going to say, please take everything off and put this gown on. I'm sure your surgeon's office had already told you this, but for any surgery you ever have, no jewelry. You can't have an earring, you can't have a nose ring, you can't have your wedding ring, you can't have jewelry down under, if you know what I'm saying. None of it. It needs to be taken off and not allowed to be worn in surgery. Okay? So just do yourself a favor, show up with none of that on so you don't have to give it to anybody and hope that your expensive ring is not lost or your husband's having to, hang on to your most precious ring. Leave all that stuff at home. So you're going to put your gown on and you cannot wear your bra, you cannot wear undies. This is you're getting ready for surgery. So you put that gown on, you get in the bed, you pull your little covers up so you're covered, and then they will come back in. The nurse will pretty quickly put an IV in. A lot of anesthesiologists are very particular on where they want your IV to be and the size of your IV. So generally speaking, they want it to be in your right antecubital, which is this right here, your right antecubital. If they cannot find it there, they'll put it somewhere else, but almost always anesthesiologists like it to be here. Another thing is, some anesthesiologists like you to have 2 IVs just in case. So if one infiltrates, which means goes bad, they all have another one and they don't have to be hurrying in the middle of surgery to put a second one in. Again, that you're not always going to have 2, but you can expect that you probably will, and one of them is going to be right here. That's just the norm. Next, they're going to hook you up to a heart monitor machine. So they're going to put leads that are just like little circle stickers here, here, here. Sometimes they do 3 leads, sometimes they do 5 leads. It's generally a 5 lead for surgery. So you're going to have 5 stickers around your chest, and it's going to be hooked up to their monitor, which is usually going to be right up above your head in pre-op. So when they hook you up, you can see your heart monitor, like you can see what your heart's doing. They're also going to put a little probe on your finger over your fingernail that is going to monitor your pulse ox or your oxygenation level. Again, that will be posted up there on that little monitor. They're going to put a sleeve, a blood pressure cuff on your arm, and again, that is usually going to be right here, and it is a disposable one, so they put it on and that stays with you all the way through the surgical process. And so they can hook it to the monitor in this room, and then it can be hooked up, and the same with all of your leads can be hooked up in surgery and then can be hooked up in your room. So they'll get all that set, and then generally speaking, they will hang IV fluids immediately, and they will also hang in the pre-op room an antibiotic. This is a precaution to keep you safe from any germs or bugs in the operating room in the hospital. It's a precaution that almost every single surgeon takes. So expect an antibiotic. Antibiotics kill your gut bacteria, which is a good thing. We want them to kill bacteria. The good bacteria gets killed also. So post-op, I like to say pre-op too, but post-op, it's really important to get on those probiotics to get your gut microbiome back to happy. We want a happy gut because the gut is hugely important in our everyday lives. You're all set, and during this time they'll let your significant other be in there with you. Usually only one person. Every once in a while they'll let 2 people back there, but often only one, and they can be with you until it's time for them to wheel you off. While you're still in pre-op, you're going to have a visit from your surgeon, and you're going to have a visit from your anesthesiologist team, somebody on their team. It could be an anesthesiologist, it could be a nurse anesthetist, but somebody that's going to be on your anesthesia team in the OR will come and talk to you. The anesthesiologist team will at that time usually give you what they call like some happy juice or some relaxation juice that'll just start calming you and getting you ready, and often they give you that in pre-op right before they wheel you back. A lot of people are really anxious, and that's understandable, and the nurses in this area are really used to that and really good at helping calm people. So that's what to expect in pre-op. Then they're going to let you say goodbye, and then they're going to wheel you down the hallway in the cot that you're on. Oh, back up. One more thing in pre-op. They give you a gown to put on, but sometimes the gown or on top of the gown is another gown. It's usually purple. I think it's just the brand. I forget the name of it. But it's hooked up to this air machine. And this air machine pumps in warm air. So if you were like me and pre-op you were hot all the freaking time, you can say, please don't turn that on. And they don't have to. The other thing is, it has a very plasticky, just off-putting smell. Most people are not bothered by it at all. But if you are sensitive, if you tend to get headaches easily, you may want to say, I don't want that air machine, because it tends to give people migraines that are susceptible to smells and migraine links. So that's just a little tip. It is not necessary. It's for your comfort. So if you are one of those people that are super sensitive, just say, I would rather not use that. Otherwise, some people absolutely love it. And then they use this also after your surgery, because after surgery, many people get major chills and shakes. Big time. And that can help. That way they don't have to keep reaching for heated blankets. They can just use that. But if you're sensitive, they do have heated blankets. Alright, moving on. They wheel you down the hallway to surgery. You get into the room, and they will just have you scoot yourself from this bed to this bed. Sometimes, and this is something they often do in weight loss surgeries, not all surgeries, but weight loss surgeries, they'll have you on this like plasticky thing. When you sit on it, there's this like plasticky thing, and you're like, what is this? This is really weird. But what it is afterwards, it's so they can move you easily. It slides on top of another sheet that's just like that on the bed that they're moving you to. And the sliding makes it easier to move a lot of weight, just point blank. Those of us that had weight loss surgery and are very heavy, when we have weight loss surgery, when you're dead weight, it's a lot of weight to move. So a lot of times they use that assistive device just to make it safer on the surgical team that's moving you, the nurses or whatever. And they'll use that moving you onto your bed in your room as well. Now, every hospital doesn't use this, obviously, but it's a possibility you may see it. So anyways, they put you onto the stretcher, and there's usually 2 arms on it, and they'll put your arms out on your side. So you're laying flat with your arms out like this. That's generally the position that they'll put you in. And then the anesthesiologist or nurse anesthetist will start hooking you up to their machine. Once they get you hooked up and you're all situated and the team is ready, they will give you more happy juice. They'll give you the medicine that knocks you out. Once you're not aware and knocked out, that's when they'll intubate you if you're having general surgery. So don't worry about being intubated. You will have no idea that it happened. You won't know when it went in. You won't know when it went out. The only thing you'll know is you might have some sore throat later. So don't worry about anything surgically. You won't know any of it. If for some reason your surgeon is using an epidural, oftentimes they will put the anesthesiologist will put the epidural in pre-op, but it's possible that they'll put the epidural in during, like, once you get into the surgical room. If you've never had an epidural, let me just explain it real quick. They will have you either lay on your side, curled up with your knees into you and your chest down, or they'll have you sitting on the side of the stretcher, legs down, chin to chest, kind of back rolled out, and they'll give you some happy juice before they do it, but it really doesn't hurt. It's just a weird pressure. Some surgeons do like to use that instead of general because the recovery process from the anesthesia is a lot faster, but most American surgeons don't do that. Most of them use general, so they'll probably have told you that ahead of time. If not, it's something you could ask before you get there, so you just know what to expect, exactly what kind of anesthesia they're going to use. So then you're, laid out, you're hooked up, everything's good, you're out, you have no clue what's happening. Now, a VSG surgery, around 45 minutes. If you have a hiatal hernia, it could add more. If you've had lots of abdominal surgeries, it could add a lot more time because of scar tissue. If you're having a gastric bypass, that adds hours also. So it's hard to say exactly how long it will be, but who cares, because you're not going to remember. The next thing you're going to remember is waking up in PACU. Now, PACU looks pretty similar to the pre-op holding, just lots of beds everywhere. You have one nurse to 1 to 2 patients depending on the surgery they're coming out of, so you're going to have a lot of attention. Some people don't remember PACU at all, but in PACU they are going to watch you wake up. They're going to watch you very closely to see how you're breathing, what your oxygen level is, what your heart rate's doing, what your blood pressure's doing. Once they get you stable, then they'll take you to your room. So the time in PACU varies per patient. Some people just take a lot longer to wake up after anesthesia. Some people wake up like that and they have no issues and they are wheeling them onto the room pretty fast. So they'll take you on that same stretcher to your room, and depending on how with it you are when you get to their room, they may use that thing I was talking about to move you from bed to bed, or they may be able to let you scoot your little self on over to the bed. Just depends. So when you get to the bed, you're waking up, you're going to notice a couple things. You're still going to be hooked up to everything. Most hospitals will keep you hooked up to that heart monitor for 24 hours. Some don't leave you hooked up to that heart monitor. It just, again, that varies from hospital to hospital and the surgeon's rules and all of that stuff. So I can't tell you for sure on that. But one thing, I forgot to say this, in pre-op, they put on these hose called TED hose. They're compression hose. They like those to be on before you get into surgery because they help with circulation. So in surgery, you will already have those on. They will have helped you put them on in pre-op. Those little things are buggers to put on. They are tight. So it's easier if the patient can put it on themselves. So they'll have you do that. But then in surgery, they will put on these little plastic leg. They look strange. I don't know how to explain it. But it's another thing that basically like massages your leg. So they go over the TED hose, and they use those in surgery to help with literally pumping to help with circulation. So you'll have those when you get to the room also, and they like you to keep those on when you're in the bed. Again, every single surgeon may not use these, but almost all of them do, because it's just another thing to keep you safe from blood clots and keep that circulation moving. Now, when you start waking up in your room and you've been in there an hour or so, if you haven't been introduced to this yet, a respiratory therapist will come in and teach you how to use what's called an incentive spirometer. I'll put a picture of it here. Basically what it does is it's this little contraption you put in your mouth and you suck in as hard as you can, and this little ball goes up. What that does is help open the very bottom of your lungs. because any kind of abdominal surgery, you automatically don't breathe as deeply because you're guarding, even without realizing it, your abdomen. Even if you're not hurting a ton, everybody does this. It's just automatic. So the incentive spirometer helps you to make sure that you get air all the way into the very bottom of that lung, because if the bottom of that lung is not opening and closing as it should, it can set you up for pneumonia. So that's very important. They'll teach you how to use it. They're going to want you to use it once an hour or so. So like 10 times in a row in an hour is what kind of is the norm. So don't ignore that. It's really, really important. Just a little note, when I was in Mexico, they did not bring one of those to my room. So I just had to work hard on deep breathing and coughing. If they don't use an incentive spirometer, another thing they could want you to do is deep breathe and cough. So it's take as deep a breath as you can, blow it out, and cough over and over. That does the same thing, but not quite as thoroughly. Also, within 2 to 4 hours after surgery, after back in your room, 2 to 4 hours, they're going to want you to get up. The first time that you get up, the nurse is going to want to be there. They want to make sure that you don't get dizzy and pass out or fall or hurt yourself or anything, and you are, hooked up to all this stuff. So even if you have someone in the room with you, that first time that you're ready to get up, call them. I recommend getting up as soon as you physically think is possible, because the main pain that comes from this surgery is gas pain, trapped gas. You will hurt in your back or your shoulder. You'll hurt weird places, and it can be pretty intense, and it doesn't feel like gas. It just feels like pain. So it's really hard to get patients sometimes to believe me that that is gas pain, and I can give you pain medicine, and I will give you pain medicine, but the pain medicine is not going to take this away. What's going to take this away is getting up and walking as early and often as possible. Walking also obviously promotes circulation to prevent blood clots, so there's so many reasons to walk. Walk early, walk often, walk as much as you can. Now, generally, for VSG, you're not going to have a Foley catheter, which would a catheter into your bladder. If for gastric bypass, sometimes they do use that. Again, no worries. They will put that in surgery. You won't feel it. And when it comes out, it's just a weird feeling. It doesn't hurt. So you may or may not have that depending on the type of surgery you're having. VSG, they don't pretty much never do that unless for some reason your surgery gets super complicated and you're there a long time and they've been pumping IV fluids in you and they feel like they need to put one in. But don't expect to have one from VSG. Your significant other can stay with you, and generally most hospitals have a chair or a couch or something that falls out, and I definitely recommend having someone with you, because on a surgical floor, nurses generally have 5 to 6 patients, so they cannot answer that call light immediately every time, and as hard as we try, we can't be there immediately, and sometimes you need someone there immediately. And if you, for some reason, are not having the best care at your hospital, having that significant other or friend just makes you feel better, and they can go out and find somebody for you or things like that. So again, use that incentive spirometer, walk, 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 walk. Gas-X strips or pills are not going to get rid of this trapped gas, because it's trapped in your literal abdomen, not in your GI tract. Okay? So just trust me on that. Walking is it. Gas-X, I mean, you can take it if you want. It's not going to hurt you, but it's not going to help you, I promise. Oh, also, post-op, they're going to monitor, at least that first day, is generally as long as you have IV fluids, they want to monitor what's going into your body and what's going out. So when you go to the bathroom, there's going to be this little thing, we call it a hat, but this little thing in the commode that they want you to pee in, and if you want to dump it out, just make sure you write down exactly how much you peed, or just leave it there, and when they come in, say, I went to the bathroom, and they'll check it and they'll empty it. But they want to know everything that goes in your mouth and everything that comes out. So once you are allowed to eat or drink, basically, they're going to measure that too. They're going to put it in these little 1 ounce clear cups. They're going to give you some water or some juice or some tea or whatever, and you pour it into that, and you're going to drink on that over like 15 minutes. So sips over 15 minutes, and then another one. sips, 15 minutes. Now this varies too. Some surgeons do not do a post-op leak test because they do leak tests during, and they have had long track records of never having a leak, so they don't. Some do leak tests as an extra precaution. So if you do go to have a leak test, they're going to take you down to radiology. They're going to make you drink this nasty stuff. It's nasty. And they will make you drink it fast. It has to go down fast so that they can watch what happens. So I just want to warn you about that too. You know, you've been told, I've been telling you, everybody's been telling you, sip, 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 never do anything fast. But for the leak test, it's not a lot, but it looks like a lot at that point. You've got to drink it fast. It's nasty, but it's important. So if your surgeon requires that, you will have nothing to eat or drink until you've had and passed the leak test. So I just want to make sure that you're aware of that. If you don't have to have a leak test, then you can start sipping early. Another suggestion I have once you've passed is ice chips. Ice chips literally are therapeutic. If you think about how ice makes inflammation go down, like if you sprain your ankle or anything like that, the same for the swelling in your pouch or your new tiny tummy. It's going to be swollen from surgery. So ice literally, one, it goes down really slowly, so it's easier on us initially. It's easier initially, but also that super cold literally helps the swelling. And the faster that swelling goes down, the easier it's going to be to get fluids down. So I highly suggest you try ice chips. Ask for ice chips if they don't bring them. If you just can't handle that really cold, don't worry about it. It's not crazy important. It's just a tip and a suggestion. So just, you know, those are my tips. I think I've pretty much covered everything. I know this got a little long, but I wanted to be super thorough for those of you that want to know exactly what's going to happen, so that it might, you know, calm some nerves. Last thing I forgot to say, many surgeons use a blood thinner shot. There are a variety of choices, so I'm not going to name the names, but they all work the same. They're going to be given in your abdomen at least an inch or two from your umbilical. So they're going to be given on the outsides of your abdomen. A tiny little sting, they're really not that big a deal, but the nurses will start teaching you very soon how to use those. They're given every 12 hours, but they will teach you how to do it. Before you're discharged, they're going to want you to show them how you do it. Or if you're having someone else do it, like your significant other, then they want them to show them so that we know that you know what you're doing. Okay, I think that's it. That was very long, and I apologize for the length of this. I just wanted to be very thorough to maybe help calm some nerves. This is very routine. Everybody knows what they're doing. It works like clockwork. They're going to take good care of you. If you have any questions on things that you don't think I covered, please ask me down below. I'm really happy to talk to you about this. If you want to email me because you have more specific stuff, my email will be listed down below. I think that's pretty much it. I hope I didn't miss anything major. I tried to cover everything that came to my mind. Good luck on your surgery. It's gonna go awesome. I'm so excited for you, and please tell me when your surgery is and let me know how you do. I would really love to know, and I will be rooting for you. I'm so rooting for you. I had mine 7 weeks ago now, and I am just so happy and so glad that I finally did this.